Hello, y'all, nursing students. Let's review this question, NCLEX question, quickly. Then I will walk you through the rationales for every answer. Are you ready? So let's look at the question. So the question is, what teaching should the nurse emphasize for a patient experiencing urticaria? Is it going to be letter A, apply topical benzene hexachloride to the affected area? B, avoid exposure to the substance that triggered the reaction? C, increase sunlight exposure to reduce itching? Or D, take over-the-counter antihistamines daily to prevent the outbreak? I want you to pause the video and review the four choices. And I'm going to give you 10 seconds to answer. Okay, so 10 seconds is up. What was your answer? If you're able to, lock in that answer in the comment section. And this is the correct answer. The correct answer is letter B. So remember, the key teaching is to avoid the trigger that caused the reaction. Here is more detailed explanation. Urticaria or hives often happens after exposure to a specific trigger such as food, medication, latex, cold, or chemicals. The most important teaching is to identify and avoid that substance. This helps prevent future exposures or future episodes and reduces the severity of the reaction. So let's look at the other choices, why they are incorrect. So let's start with letter A. So option A is incorrect because benzene hexachloride treats scabies. It's not used for urticaria or hives and carries neurotoxicity risks. It should never be applied to hives. Letter C is also incorrect. So option C is incorrect because sunlight does not reduce the itching. Heat and UV exposure can irritate the skin and sometimes make itching worse. Patients with urticaria should avoid heat on affected areas. D is also incorrect because antihistamines help treat symptoms, but daily use to prevent outbreaks, quote unquote, isn't standard teaching unless a provider prescribes it for chronic urticaria. Teaching still centers on identifying and avoiding the triggers first. Okay, so just a side note, if you want more high yield NCLEX questions with rationals, check out my nursing cram study guide. The link is actually in the description. Thank you for watching.